I'd like to focus on the expected number, because this is a way of determining how we can cope with this problem. And even if an individual case, for example, is manageable, as repeatedly assured by the DOH, if we are swamped with quite a huge number, then it may become, on the macro level, unmanageable. Now, in the last hearing, Dr. Sui mentioned that it's possible that about 25% of the population may catch this virus. Is this still the position of the DOH, Mr. Chairman?
Okay, the 25%.
25 million, I think. Did you say 25% or 25 million?
Thank you, Honorable Chair. The 25% was based on the computation provided to us by WHO based on the global situation of influenza AH1N1. Now, it's actually a conservative count because currently the attack rate globally is at 30 to 35%. But then based on the figures that we are seeing right now, even every 25% happens, it doesn't really mean that it gets to happen, say, this year or the next year. It may happen continuously in the next succeeding years.
In the next succeeding years.
Mr. Chair, if I may just expound a little bit on the 25% projection rate which the WHO has formulated. This is actually true for purposes of pandemic planning, but it doesn't necessarily follow that this is going to be the rate of infection that we're going to come across.
Well, yes, we understand that, but it's always good to be conservative in projecting what's going to happen instead of being optimistic. Just like anything else, I think a doctor is always conservative instead of optimistic. Now, if it's 22.5 million, that is 25% of the population based on roughly about 90 million. May I again have the figure on mortality? What is the mortality rate? Because last time, the mortality rate being mentioned was way below 1%. I think 1 point. But I see a different figure now. What's the mortality rate? That's why I was asking for a hard copy.
Sir, excuse me, if I may answer. The mortality rate right now of AH1N1 is 0.06%, Your Honor. That is in the Philippines. And globally, it is globally it's 0.6.
I think. That's
0.6. I'm sorry. 0.6 for the Philippines. 0.06 for the Philippines, and 0.42 globally.
0.42 as against 0.06.
Yes, Your Honor.
That is based on one fatality. Based on the population, on affected, what is the affected number? 1,700?
1,709 as of June 27, Your Honor.
So you divided 1 by 1,709 to get...
That is right, Your Honor.
But on the whole, on the average, because that is an isolated figure, we'll be lucky to maintain that. Because the moment you get another one, on the base of, let's say, 2,000, then it will jump very quickly to a much higher percentage. So, but if we base it on WHO, what would be the mortality rate based on WHO?
The mortality rate worldwide would be 0.42%.
0.42. So if we base it on 0.42, I multiply the 22.5 million. What do we get, Dr. Sui? Let's say eventually after several years, 22.5 million are affected, and we have an average of 0.45%. What would be the fatalities? Sure, you have your computation.
Yes, roughly half of the cases was roughly around 0.5% if it's 0.42. If we're going to consider 0.5, then half of the cases detected would be dying. You were going to...
Beg your pardon? No, not half. Because if you're talking of 22.5 million that may be affected,
Yes.
0.5% may die, right? And 0.5% of 22.5 million, what is your computation? I have my computation, but I want the figures to come from the DOH.
Okay.
Roughly
924.
I beg your pardon? Because certainly you have already made some projections. My projection is 94,500. Almost 100,000. So we can say that it is probable, not really likely, but it's probable that 100,000 may die of this pandemic before it dies out also. Because I think the natural process is that, as shown by your curve, it will go exponentially up, and eventually it will die out and become a seasonal flu, as Secretary Duque said. So that's correct.
Sir, it may eventually assume the trend that we observed in the seasonal influenza. But we cannot say for sure because we're still at this stage where we have to keep monitoring the situation and the behavior of the virus.
So 100,000. Would you consider 100,000 deaths from this as a serious problem compared with other problems that we're encountering, like dengue and infection, other diseases? We have the opinion of the DOH. I'm trying to look at this in relative terms, relative to the other health dangers that people are facing. Like, for example, in poor communities, yung mga tao namamatay pa rin sa tigdas. In affluent communities, tigdas is a minor thing, but in poor communities, tigdas can be a killer. So may we have the opinion of the DOH?
Yes, Your Honor, the 100,000 is such a huge burden of death. In any way we put it, I mean, in whatever country, whatever setting, certainly the 100,000 is an overwhelming figure, Your Honor.
Now, we are looking at an exponential growth right now. Just the last hearing we had, I don't know when was that,